Greetings, my fellow nurses. Welcome to my new San Diego traveling assignment. I'm not going to complain. It's been beautiful. The weather out here is gorgeous, and I'm doing okay. For those who are wondering how I'm doing, thank you. I love you guys. So no, seriously though, let's get back to here. What I'm going to be discussing is time management. The $1,000,000 question I had for today was how to do time management in the nursing field. Now, don't get me wrong. There's times that everyone's going to fall behind. What they say is you got to communicate with your nurses. Instead of saying, hey, I need some help, get that one nurse that you know by name or whoever's there, and they directly will stop, look at you, and say, what do you need? So every time you need assistance, call them by their name and get them in there to help. It could be administering meds, it could be helping with turning the patient, it could be also just, what if the patient's circling the drain? So you want to make sure you have a good squad, good team, great communication skills, and advocate, and also for sure start pushing for assistance when it's needed. So like I said, time management, very important, right? So when you get on the clock, get report, make it no longer than 2-3 minutes, figure out what's going on with the patient, what drips they're on, what mechanical ventilation, what their settings are, and most importantly, the recommendation from the nurse, what changes the condition, what the background is and the history of the patient, and what their main diagnosis is when they walked in and came into the hospital. And when you end the report, you want to know, what are we going to do to get them better? So for your shift, you at least know what you're going to do to get them in and out. It's most importantly to find out the plan of care. We all know we hate care plans, but that's most importantly for a patient who's on mechanical ventilation with the PEEP, FiO2, and you're dealing with their ABGs every 6 hours, their blood work. You want to make sure you follow compliant with what's going on with the patient, so that's very important. One day you can get a neuro patient, next day you can get a cardiac patient, or you can get a combination of all three comorbidities with pulmonary, endocrine, and also cardiac. So of course you watch the monitor, making sure they're all right, but you got to make sure you're gonna have two patients. The other one could have, I don't know, it could be a neuro patient and facial fracture, rib fracture. All of a sudden they came in for trauma, they have a lumbar drainage, and you have to deal with that. So you got to make sure with time management skills is build a plan, get your meds, figure out what's going on, find out what time the labs and everything's going to be set and drawn so you can get it out. Get it all set before you give reports so you can get anything that you need to replace. Electrolytes, potassium, magnesium, sodium chloride, sodium phosphate, and you stay on top of that because it's very, very, very important because things could flip like that, like a switch. So you want to make sure you're staying compliant with what you do in patient care. So time management does take time, but once you get it all set and have a plan, you keep following that. And I swear to you guys, nothing follows as planned. So you got to make sure you stay on your toes, get a care plan with a care plan, so if that makes sense. But you always want to make sure that you take care of your patients. They come first. You're monitoring, you're looking for changes of condition, and you stay on top of your charting, documentation, and communicate with the doctors and let them know for any changes that happen right then and there. So that's the one thing that I like about working critical care. You have an intensivist right there at the bedside, which is gorgeous. It's beautiful, it's nice, and it is a lifesaver. So hopefully that helps, my fellow nurses. Don't forget to subscribe, like, comment, drop anything what you want me to do for my next nursing video. And most importantly, y'all, welcome to my San Diego assignment. Love you guys. Please love, advocate, nurse on. My fellow nurse brothers and nurse sisters, peace. Oh, before I end this video, don't forget to follow me and subscribe on Twitter, Instagram, and also PERISCOPE. I'm dropping new stuff and new material there. All right, nurses, love you guys. I'll talk to you guys later. Peace.